Hello future nurses. Confused about electrolyte imbalances? In this video, let's make phosphorus imbalances, that is hypophosphatemia and hyperphosphatemia, clear, including causes, clinical manifestations and management using easy mnemonics so that you never forget. So let's begin. Phosphorus. The normal level of phosphorus is 3 to 4.5 mg per deciliter. Now, the normal level is 3 to 4.5 mg per deciliter. That means two conditions occur when phosphorus is out of balance, either hypophosphatemia or hyperphosphatemia. So, before discussing the condition, let's discuss reciprocal relationship. What is reciprocal relationship? A decrease in the serum phosphorus level is accompanied by an increase in the serum calcium level, and an increase in the serum phosphorus level is accompanied by a decrease in the serum calcium level. This is called a reciprocal relationship. So, reciprocal relationship is between phosphorus and calcium. That means when there is decrease in serum phosphorus level, serum calcium level is increased, and when the serum phosphorus level is increased, that is accompanied by decreased serum calcium level. So this is the reciprocal relationship. So whenever we are correcting calcium or we are monitoring for phosphorus, we have to consider the other electrolyte. While monitoring phosphorus, we have to keep an eye on the serum calcium levels. So this is the reciprocal relationship that is between phosphorus and calcium. Now, let's discuss hyperphosphatemia. Hyperphosphatemia, a condition where serum phosphorus level exceeds 4.5 mg per deciliter. That means phosphorus level is more than its normal value, that is more than 4.5 mg per deciliter. Let's discuss the causes for hyperphosphatemia. Hyper means high. There is high phosphorus level. So the mnemonic for causes is high phos. H. H stands for hypoparathyroidism. Parathyroid hormone is secreted by the parathyroid gland, which is necessary to regulate phosphate levels. So, if it is the condition of hypoparathyroidism, that is decreased parathyroid hormone, so the phosphate level regulation is impaired. I. Injury, tumor lysis syndrome. In conditions like tumor lysis syndrome, the intracellular phosphate is released into the bloodstream, leading to excessive accumulation of phosphate in the blood. G. Glomerular failure. We know that phosphate is excreted through kidneys. So, if the kidney function is impaired, there is reduced excretion of phosphate, leading to accumulation in the blood. H. Hypocalcemia. Hypocalcemia and hyperphosphatemia. This is due to the reciprocal relationship between phosphorus and calcium. P. P stands for phosphate enemias or phosphate laxatives. Certain medications and also enemias or laxatives contain phosphate. So, if these are used excessively, the condition of hyperphosphatemia can develop. H stands for hemolysis. Hemolysis is the breakdown of red blood cells. When red blood cells breakdown occur, the intracellular phosphate is released into the circulation, due to which there can be increased phosphorus level in the blood. O stands for overuse of supplements or phosphorus containing drugs. If there is excessive intake of phosphate containing supplements or drugs which contains phosphorus, then high phosphate levels can occur in the blood, leading to the condition of hyperphosphatemia. S stands for severe infection or shock. Severe infection, shock, these are the conditions of physiological stress, and due to these stress conditions, cellular damage can occur. And because of cellular damage, more phosphate is released into the bloodstream, leading to increased phosphorus level in the blood. So, these are the causes for hyperphosphatemia, which can be easily remembered with the mnemonic high phos. Hypoparathyroidism, injury, including conditions like tumor lysis syndrome, glomerular failure, hypocalcemia, phosphate enemias or laxatives, hemolysis, overuse of supplements or phosphorus containing drugs, severe infection or shock. The clinical manifestations for hyperphosphatemia. Which sign and symptoms will occur due to the condition of hyperphosphatemia? We know that there is reciprocal relationship between phosphorus and calcium. So if it is the condition of hyperphosphatemia, then accompanied there can be hypocalcemia. And we know that in condition of hypocalcemia, as calcium is necessary for muscle contraction and nerve function, so muscle twitches, tetany, hypotension, brain symptoms will appear. So similar symptoms can also be noticed in condition of hyperphosphatemia. So let's discuss the clinical manifestations of hyperphosphatemia with the mnemonic cramps. C stands for confusion or convergence. These are the neurological symptoms which will occur due to electrolyte imbalances associated with hyperphosphatemia and also hypocalcemia. R. RS reflexes increased, hyperreflexia. Uh, as we know that phosphate is needed for ATP production. Also, if there is increased phosphate, increased ATP production, so the reflexes means more energy is supplied. So hyperreflexia can occur. A stands for arrhythmias. Cardiac rhythm disturbances will also occur due to the electrolyte imbalances of phosphorus and calcium. M. Muscle cramps or muscle spasms. These are also similar to the reflexes. This occurs because of muscle excitability due to high phosphate. P stands for pruritus or skin itching. Phosphate, if there is excessive phosphate, then phosphate can deposit in the skin, due to which there is increased skin itching or pruritus. S, that is soft tissue calcification or skeletal pain. Soft tissue calcification can occur in condition of chronic hyperphosphatemia because the calcium phosphate crystals will deposit in the soft tissues, and so because of which there can be skeletal pain and bone pain can occur. So these are the clinical manifestations that can be seen in the condition of hyperphosphatemia, which is remembered by the mnemonic cramps. Confusion, convulsions, reflexes increased, hyperreflexia, arrhythmias, muscle cramps or spasms, pruritus, skin itching, soft tissue calcification or muscle pain or skeletal pain. How we will manage the condition of hyperphosphatemia? For management, we have to fix the high levels of phosphate. So the mnemonic for management is fix high, means fix high level of phosphorus in the blood. F stands for fluids plus diuretics. This involves we have to administer IV fluids and diuretics to promote the excretion of excessive phosphate through the kidneys. I. Intake restriction, low phosphate diet. Limit dietary intake of phosphate to prevent further accumulation. X. X out phosphate medications or enemas. That means discontinue or avoid the medications or enemas that contain phosphate to prevent phosphate loading in the blood. H. Hemodialysis. If renal function is impaired or in severe cases of hyperphosphatemia and decreased kidney function, the excretion of phosphate is impaired. In that cases, hemodialysis can be used to remove excess phosphate from the blood. I. Increased calcium. That is, if we will increase calcium level, then phosphate can be corrected, because in condition of hyperphosphatemia, due to reciprocal relationship, there is hypercalcemia condition too. So we can increase calcium intake to balance phosphorus levels. GI phosphate binders. We can administer GI phosphate binders, or mainly the calcium acetate is a GI phosphate binder which is taken with meals to bind dietary phosphate in the digestive tract, which will prevent the absorption of phosphate, leading to the balanced serum phosphorus level. H. Hormone therapy. Hormone therapy can be given in certain conditions, and mainly the hormone calcitrol is given, which is required to regulate calcium and phosphorus metabolism. So this hormone can be given as a part of management strategy. But it is mainly given in cases of severe hyperphosphatemia. So this is the management for hyperphosphatemia, which is remembered with the mnemonic fix high. Fluids plus diuretics, intake restriction, exout phosphate medications or enemas, hemodialysis, increased calcium, GI phosphate binders, and hormone therapy. So this is all about hyperphosphatemia, including the causes, clinical manifestations, and management of hyperphosphatemia. Stay tuned for easy explanation of other electrolytes in upcoming videos with Smart Mnemonics with SmartNurseGuide. Thank you.